Hello everyone, my name is Dylan Cookson, here in Midcoast, Maine, and today we're going to be talking about something that I'm sure you're all sick and tired of hearing about. That being, vaccine conspiracy theories. As of right now here in the state of Maine, there are a number of options for non-medical vaccination opt-outs. And unfortunately, non-medical opt-outs for vaccinations have become distressingly common, leading to a number of major problems throughout the state. One of the major concerns for the high instance of non-medical opt-outs here in the state of Maine is the loss of herd immunity. Herd immunity is a medical phenomenon where, once a certain percentage of individuals within a community have been effectively immunized, the chances of a disease spreading even among non-vaccinated individuals within that community decreases dramatically. The current herd immunity goals for the state of Maine are 95% of our school population. However, our current vaccination rate among our schools is only 93.8%. Vaccination rates for all of the diseases except chickenpox are below herd immunity goals. Of particular concern to those of us in Knox County, Maine, are that our school's vaccination rate has dropped to 89.1%. 54% of Knox County's schools do not have herd immunity, and Knox County also has the worst MMR vaccination rate at only 91.2%. Statewide, Maine has one of the highest instances of pertussis, otherwise known as whooping cough, in the country. To address these concerns, on February 12, 2019, Representative Tipping of Orono presented LD number 798, an act to protect Maine children from preventable diseases by repealing certain exemptions from the laws governing immunization requirements. Quite a mouthful of a title there. Link number 3 in the description of this video will take you directly to the legislature.maine.gov listing for the bill so that you can see a full text document. But to summarize, the bill just cracks down on vaccination opt-outs justified by religious or philosophical reasons. Now, before we get on to the meat of this video, I wanted to let you know what I consider to be very good news. Last week, that being the week of April 7th to the 13th of 2019, the bill passed out of committee 8-5 with an ought-to-pass status. There were a number of amendments, including those that clarified and strengthened the medical exemptions, increased transparency on the list of vaccines required a biennial report from the Maine CDC to the Health and Human Services and the Education Committees on immunization effectiveness and safety, and pushed out the effective date of the removal of non-medical exemptions to September 1st, 2021, in order to allow for rulemaking and compliance. Now, I suppose you might be wondering at this point, what is the bad news? Well, prior to the bill passing committee, Senator Dave Mirmant of Maine Senate District 12 submitted testimony opposing the bill. That in and of itself isn't so bad. After all, that is part of what senators do. The problem in this case is why the senator opposed the bill. His testimony in opposition contains a number of misconceptions and appeals to long-debunked conspiracy theories, including concerns about drug companies putting poisons in vaccines and the non-existent link between vaccines and autism. The senator's testimony prompted a number of responses, including a point-by-point fact-check from Suit Up Maine, an all-volunteer alliance of progressive activists, and a call from the Midcoast Maine community, where a number of concerned citizens, including several members of Midcoast Indivisible, as well as a representative of Suit Up Maine, and members of Maine's medical community, organized a meeting with Senator Mirmant at the Three Dogs Cafe in Rockport, Maine. I volunteered to record the event on video, and that's what I will be sharing with you today. A quick note before we start. I am not a professional videographer, and unfortunately, I don't exactly have the best equipment. In fact, all I had to record the event was my own little cell phone camera. The microphone only has so much gain on my little phone, and unfortunately, we were recording inside a crowded restaurant. So I had to dart back and forth a few times in order to get clear footage and audio of different speakers within the group. including Senator Mirmant himself. So, for those of you who might have a difficult time dealing with conflicting or overlapping sounds or a slightly shaking camera, my most sincere apologies. I did the best I can with the resources I had available. At any rate, I believe that what was discussed during this meeting is of concern to all Maine people, especially those within Senator Mirmant's district. The senator is meant to serve and represent the people of Maine. His ability to competently function as an elected representative depends heavily on his ability to recognize and act on the best available information. This footage was recorded April 12, 2019, with Senator Mirmant's permission. And now on to the video.
Excuse me.
So thank you, David, for coming on short notice.
Certainly.
Sorry you thought it was 50 people, but we didn't really know how many people, and we wanted to be inclusive to as many concerned citizens as we could. And we also heard from people in the medical community and the school system and others who wanted to be included so that they could voice their concern. So thank you very much for taking the time. I know you're really busy, and we do appreciate. And come on in. There's a seat right here, Jeremy. So I'm going to pass it over to Caroline, who is the introduction. You have something you'd like to say?
Sure. I'm Dr. Adawakis. I'm a pediatrician in Penn Bay. Some of you many of you actually know, which is nice. I'm here on behalf of our group, and I think to a certain extent the hospital too, with concerns about unvaccinated children placing other children at risk in the public school system. I come at this from a perspective of having practiced in several places around the U.S., including Hawaii, where unfortunately we saw a lot of kids from around the Pacific Basin with vaccine-preventable diseases that we don't see as much in the mainland U.S. And I think in this nice world that we live in Midcoast, Maine, we can forget that there are some very bad things in the world, and some of them are childhood diseases that are rarer here now than they are other places. And we see that in certain parts of the U.S. We see that, unfortunately, right now in New York. We see that in Midcoast, Maine with pertussis annually. This winter's been particularly bad. So we all feel very strongly that it's very much in children's interest to be fully vaccinated against common, unfortunately, very dangerous childhood diseases. And we get very concerned about some of the recent bills that have been in front of the legislature. I see kids, I have my own kids, and I see kids who are in a range of clinical situations. So yes, I feel that it's important to have a medical exemption in place. There are people with cancer chemotherapy that can't receive live vaccines, and that happens. Those same kids, unfortunately, when they go to school, get exposed to illnesses. And if one of those illnesses is an otherwise preventable disease, they face a very real risk of becoming very seriously ill and possibly dying from that disease. So I am very much an advocate for vaccines whenever they can safely be given, and feel fairly strongly about that, not only for my kids, but also for my patients, both the healthy and the more fragile. Yeah. I read through your testimony. I was disturbed by things that I think have very little basis in scientific fact, and some research which has been very problematic was later proved to be fraudulent, but still persists around the internet. So I'm concerned, based on what you testified, that you may be coming at this without adequate information. And because you're a public figure, you get a lot of attention. Yeah.
One of the things in your testimony, I do clinical research and infection prevention at the hospital, was that vaccines have not been researched except MMR. And in my tiny little piece of the world, I personally have researched 3 different vaccines and put several hundred people on studies before the vaccines were approved, doing blood tests, keeping diaries, checking their temperature every day, reporting any side effects. And yet you said in public that research was not being done on vaccines, and that
really was shocking that you could say that. And we know, I think we all know, we're not going to change your mind about vaccines, and you're not going to change our mind. A big concern I have is there are about 40,000 people in Knox County. And if, say, the vaccine rate, if you look at all the vaccines, is an average around 90%. So presumably around maybe 10% of the people are anti-vaccine. Now, it's probably less than that because some of them are medical exemptions and things, but say it's 10%. You are representing 4,000 of the 40,000 people, but you were elected to represent us. And you're representing your own personal view, not our view.
That would be the case if only viewpoints that I had heard from were your group. We actually, at the hearing for the bill that started this, more than 60% of the people testifying were against the bill because it didn't allow any exemption, which is why it ended up being amended. There was 1,600 only within the scope of what the drug companies have put out for a schedule and an allowance for an exemption from that. And it was so narrow that even previous adverse reaction to a vaccine did not allow an exemption from having it injected again. These are the kind of things that people don't like and we're fighting hard against. The emails to me have been, there are more that support my viewpoint and are against LD 798 than are for it.
Do you have a count on that?
Don't keep an exact count.
I'd be interested to know if you could do a tally for us.
I'd say it's not the same as the people who testified, about 60%.
Really? I'm surprised by that. I would love to have an actual
Well, that's what
tally.
you're gonna get, is about 60%. If it was off, it was 90-10 or something, then I would start to question. I don't just represent my own ideals. I'm very secure in the fact that people have supported the exemptions to the schedule that's been put out by the drug companies. So there are other doctors too. The drug companies get a doctor who they sponsor to do research with their money, it works for them, and that's where they give these recommended schedules. There's over 250 more vaccines in the works. Another thing that the bill was amended to do was not to allow any new vaccines to be required in Maine without further research by Maine, and I'm not sure who else with them. So there were some changes that just support the fact that there's an exemption that needs to be allowed.
Are you going to support it now with the amendment?
I'm still mulling it over based on the testimony that I have and just on the emails that I'm getting and stuff. So I'm still working on that, and we have a 95%. If you're starting to talk about all of these, it was claimed that we need a 95% compliance for herd immunity. We have it in Maine. When we get to 95,
We don't. It is 93.8.
I'll tell you what I'm going to do. I'm going to
that
talk,
data just
and then
came
when I
out.
stop, you can talk.
That's
If
fine,
you
but-
won't do that, I'll leave.
That's fine.
Got that?
But it's important
I
that
sent,
factual
you took my
information is
testimony
shared.
without talking to me, then you annotated it and put it up, and then you sent me 3 emails, all of which I responded to. You put none of it up. Your comment in your site was, I asked Mirmant for more information, and he only sent me the same as his testimony. That's what you said on the website. You never put any of those up. It
I'm
was
I'm
not
happy to
the
put them
same.
up so people can
Okay.
see the four.
So I'm not
the-
going to sit here and argue.
the two
I'll talk and I'll give you
books,
answers.
a website, and a movie.
Exactly.
Those
There
were
you
your
go.
sources.
Those were for, that's all I needed to give you for now.
Okay.
So that's how we do it in the legislature. We talk and then another person gets to talk.
Go
We
ahead.
respect that, okay? So with that success rate, this is with the complete philosophical, religious, and medical exemption, we have 95% as a success rate here in the state. You brought up pertussis. Pertussis on its best day, when you first inject someone, it's only 70% effective. So when we have these stories about pertussis outbreaks, it's usually of vaccinated kids infected by other vaccinated kids. That doesn't get reported. It's because with such a low, low compared to what you think. You think if there's a vaccine, it's going to have a high success rate. 70% on its best day. In 4 years, it's only 40%. And some people claim those numbers are high. So if you have 100 kids in a class and 30% the vaccine is not effective, you could have 30 of them with pertussis. You could have this big outbreak. So these are part of the things that don't get reported.
Dave, I understand
I'll
your.
stop so there's breaks here.
I think that people need a chance to respond when you're
I'll give breaks,
so
yeah.
we'll just respond one at a time to some of your claims, and some of these claims have been responded to by email
If I may,
when people contradict
the rates
the
of,
facts. So
regardless of the effectiveness of the pertussis vaccine, the rates of any infectious disease go up when the vaccination level in the community goes down. Yeah. The other comment that you made a moment ago about the drug companies being in charge of the vaccine schedule is inaccurate. The vaccine schedule comes from the CDC in coordination with the World Health Organization, and there is a fair bit of effort to try to keep any drug company bias out of that. I recognize it's an ongoing challenge, but the drug companies do not dictate a vaccine schedule. It's simply not how it works.
I do believe the drug companies have a big influence on the CDC.
they do.
He thinks they
The
do.
other fact that Karen wanted to dispute was the 95%. We do not have 95%. We have
No, we
93%.
don't. We are now under herd immunity at 93.8% statewide. And those are the 2018, 2019 numbers that just came out. So, and all of the numbers are down across the board as far as our immunity rates. So that's, for all the diseases except chickenpox. Chickenpox we have herd immunity for. And Knox County has the worst rate for MMR vaccination in the state. The worst. And we've got measles outbreaks
We
happening
haven't
right
had
now.
a case of measles in Maine in 10 years.
Excuse me. Measles outbreaks that are spreading across 15 states.
We've had exposure to people with measles twice. We still haven't had a case of measles in 10 years in Maine.
Okay, so Knox County, do you know what the vaccination rate for Knox County is? Do you think it's herd immunity close to it?
I'm not going to get into a discussion of that because I don't believe herd immunity works the way that it's supposed to work because there's so many of these vaccines being protective of individuals or the shedding from live vaccines.
So even though there are multiple large-scale, long-term peer-reviewed studies that show that herd immunity is a scientific fact, you won't believe that.
There are other disputes from the other doctors about some of those studies. There are no double-blind studies. When they gave the drug companies immunity from any adverse reactions to vaccines, then research did not continue in any meaningful way. They don't have liability, they don't have to pay, they don't put money into the studies.
There's so many things. I just want to circle back to the Knox County immunization rate. It's under 90%. It's 89.1% vaccinated. So that leaves our schools really very much at risk for a measles outbreak to happen, pertussis outbreaks are happening, and of 54% of our elementary schools are under the herd immunity rate. 54%. Sorry, you want to jump in?
And they could remain that way with the medical exemption if it's determined that that's the reason for that many kids to not have to get vaccinated.
I want to introduce myself.
Hello.
I'm Janice Hogan.
Hi, Janice.
I'm the school nurse for Camden Hills Regional High School.
Okay.
And I also serve on the board of directors for the National Association of School Nurses. So I just wanted to speak to a couple of things in that Camden Hills is at about 8.9% on kids with exemptions. So that is one of the higher rates within our state that we don't have fully immunized children. And I can speak to the fact that we have only 2 students out of all of those that have a medical exemption. Now it may be that others would qualify for a medical exemption, and I certainly support that in concert with the school physician. But in the past, we had, about 3 or 4 years ago, we had an outbreak of or a student that had chickenpox. And I believe we had about 24, 25 students that year that were not fully immunized. Only one of those 25 elected to remain out of school for the required 21 days. The rest of the students got the immunization and returned to school the next day. So, I fully support medical immunization or exemptions, but I do believe in the support of the American Academy of Pediatrics and the National Association and the CDC support for vaccination. I just want to give you, this is the letter of testimony from the Maine Association of School Nurses, and there is a list of nurses that signed on. And also, when you have time, this is a booklet from the Children's Hospital in Texas. And a couple of years ago, the author came and spoke at the Infectious Disease Conference. And this book highlights the other side of the story of families who were affected by these vaccine-preventable diseases. So I know we hear a lot of the other side of the fear factor, but I hope you'll take time to read that. And I would be happy, please contact me if you have more questions. I put my card right here, and I would be happy to talk to you further.
Thanks.
Okay, really nice to meet you. Thank you.
Thanks.
Excuse me. So I want to make sure before I critique. Did you say that there were medical studies that were inconclusive?
Yes, they haven't been double-blind studies on these issues.
So any medical study that shows that vaccinations in general, I mean, they didn't disrepute it. They're disreputable. I mean, the medical science is very clear. Almost every health commissioner in every city is arguing for mandatory vaccination, unless a physician says it's not, it could be harmful. Those medical studies that the anti-vaccination people cite, they're disreputable. The Lancet has disproved them. The New England Journal of Medicine has disproved them. I mean, this is flat Earth theory. What we're talking is flat Earth theory.
So part of what you're talking about, the Lancet in Wakefield, they're always saying that was disproved. What Wakefield was doing, along with 11 other doctors, they were looking at autism, children with autism, and they had nothing to do with vaccines. But when they all got together to talk on these different cases, it turned out that they had all been vaccinated, and from that point on, they'd seen the symptoms of autism. The British Medical Association immediately threatened all 12 with revocation of their credentials, and 10 of them immediately just backed off. One of them went and fought it at the board, and the board backed down, and Wakefield stood up and said, look, I'm not saying it causes autism. I'm saying we found this causal fact. No, you can't. We found this, and we're only saying, please look at this possible cause. And they said, no, there's no cause. They get up and they say, we don't know what causes autism, but it isn't vaccines. Like, if you don't know what causes it, you can't know that something doesn't cause it. I'll tell you what, when I stop, I'm just about done, but you cannot interrupt. Okay, so that's where the Wakefield situation is, and that's the one they're always saying the Lancet disproved it. It didn't disprove anything. Wakefield never said it caused it. He only says it might. You need to study it further, and that's what he's stuck with all these years.
And they did study it.
So can I address that?
To Bill Stevenson.
Hi, I'm Bill Stevenson, one of the pediatricians. So because we get this question a lot. The Lancet study, the Wakefield study referred to, you're right, the 10 other authors, when it turned out Wakefield was getting money from legal groups seeking to sue vaccine manufacturers. So, but let's just take Wakefield at his word. He found this. They didn't actually distinguish whether they were finding measles related to vaccine or wild-type measles. Okay, so let's just say for a minute, I'm not saying it's true, Wakefield got it right. So the question becomes, what is the rate of autism in the unvaccinated population? So that study was done. In Europe, as a result of the Wakefield stuff, there was tens of thousands of kids who were not vaccinated. So you automatically have a population that you can study to compare vaccinated and unvaccinated kids with regard to autism. They found no difference in the rate of autism between the vaccinated and unvaccinated group, and this is using tens of thousands of kids. So it was a New England Journal study. So to say that it wasn't anything to discredit it, that's not entirely true. There was subsequently a paper that I've read the review of, I haven't had a chance to read it specifically, which adds further data to that the rate of autism in unvaccinated kids is no different from vaccinated kids. Okay? There's a couple other things that you brought up I just want to touch base with you about. I saw this in a report of your testimony, so if it's not true what you said, so forgive me. One is that we put poisons in vaccines. Which ones are you talking about?
Yeah, I know that one is not being used with mercury anymore, but that there's heavy aluminum content in another, and I don't have all that at my fingertips.
So, well, I just, you
And
testified.
aluminum is also linked with Alzheimer's and others that they're trying to study now. There are dangers in too much aluminum.
So the amount of aluminum in the vaccine is less than you get from drinking a can of soda. So if you drink a can of soda, you're getting more lead in your system. The times that lead is aluminum, forgive me, aluminum, you don't want lead in your soda either. So the amount of aluminum you get, again, is more from a can of soda. And then the only times where the aluminum's been shown to be an issue with folks, it's like elderly ladies who are on dialysis or something like that. And so there's been, so let's say for a minute, okay, maybe there is something with this aluminum bit, right? So there's another couple studies where they looked at what's the developmental outcome for someone who's been vaccinated one time or two times or three times or no times. So the question is there something in these vaccines that is stimulating some sort of developmental disorder, some sort of developmental delay? And then the question is someone particularly susceptible, like if you got one vaccine or you got four, you got six? Turns out there's no difference in developmental outcomes based on the number of vaccines you get. The other thing I thought you were going to bring up with regards to things in vaccines is formaldehydes in some vaccines. And so people are like, oh my gosh, these people are nuts. Why are they putting formaldehyde in their vaccines? What it is a preservative. And you actually make formaldehyde every day. Your body makes about, I think, this will be for posterity, it's being recorded, but I think it's about 50 micrograms a day. And you need that to make DNA. If you don't make formaldehyde, you don't make DNA. And so the vaccine is about 35 micrograms in it. So there's a lot of stuff that are in there that when you just look at it at face value, you might say, oh, what are these crazy doctors doing? But there's actually a lot of good science behind it. So, sorry, I'm monopolizing.
I would like for you to address the mercury issue, though, because that was in your testimony.
Yeah,
About the thimerosal.
Thimerosal. Yeah, so if you got down on your knees and begged me to give you a vaccine with thimerosal, I wouldn't have been able to do that since, I think, 2002. So it was deemed biologically plausible that the thimerosal could have an impact in developmental outcomes. So it was removed. And so what's important to know is after, let's say the thimerosal was a big driver of autism or other developmental delays, you'd expect when we took it out of all vaccines and no kids were getting it, you'd see a change in the rate of autism. And sadly there wasn't. So, but it's important to know that there's a difference between thimerosal, which is ethyl mercury, I'm sure it's ethyl mercury, and mercury you get from eating fish and things like that. The stuff that's in thimerosal, your body's able to break down. And as soon as it gets injected, you break down about 50% of it, at least I think within a week. It's pretty fast. Whereas the mercury you get from eating fish, which I believe is methyl mercury, you can't. It gets stored up in your fat. So vaccines, again, it was deemed biologically plausible not to cause an effect, and so it was taken off. It was just taken out of vaccines. The only thing that it was in, you might think maybe in some multi-dose vials for flu vaccine, but I haven't used that in decades. Decades.
Pardon?
It's only the multi-dose, you're right, but
Yeah.
we don't It's not getting more because
Yeah, we
it's
don't,
just considered an infection from another day.
yeah, so,
You're
yeah.
right. It's out of everything else.
Yeah, so, you know, so there's a lot of stuff out there in the world. It doesn't take much time on Google to be like, oh my gosh, like, what's going on here? But it's something we as pediatricians, we read, and a lot of other folks, but I can speak to pediatricians, we read a lot about because it's so important because we give to so many kids. And then you also made a statement about vaccines once they get released, you know, how do we know they're safe? What happens? And I could discuss that. I don't want to monopolize, but I could discuss that too. But I don't know if
I would
anyone.
love for someone to take on the topic of herd immunity because that's another issue.
I kind of want
It's
to,
a tough
Would
one,
you
I
like
think,
to?
not
because
that one.
Oh.
in order to truly prove herd immunity, you probably have to check titers in each of us to how immune we are to a particular disease, right? I mean, you could circle this topic forever.
But for diseases
I
like
do think it's
measles and
I think
pertussis,
it's
which
a
are
public
highly
health issue, though, and I think the risk of getting down into details with all of the, excuse my phrase, but us, the kind of crazy stuff that turns up on the internet, is that you lose sight of the fact that there are a few big advances in science and medicine which have reduced childhood mortality and morbidity, but mostly mortality, down very significantly over the last 150 to 200 years. I mean, it used to be somebody my age with 3 kids would have had a significant risk a few hundred years ago of losing at least one of those children before the age of 5. And now most of us don't worry about that. And I think because we live in this nice world that we perceive as very safe, we lose sight of the fact that childhood vaccines, clean water, and antibiotics have led to a real change in our health as Americans. And if you take any one of the legs of that 3-legged stool out, unfortunately, I'm afraid our world will change. We'll see a lot more disease, a lot more very sick children, and unfortunately, a lot more deaths. So that's why I feel so passionate about this.
I would like to also address the risk to adults when you have low herd immunity, because there are adults who are vulnerable to disease for whatever reason. They may have had a stem cell transplant, or they may be very elderly, or they may be a newborn baby that hasn't had vaccines yet, and those human beings are very, very susceptible to these diseases, and they rely on the fact that 95% of the people they're in contact with have been vaccinated, so their chances of getting a disease are very low until such time that they can get up to date on their vaccines. So it's not only children's lives that are at risk, but also adult friends and new mothers with new babies and the elderly and people in nursing homes. I mean, if in Knox County it's down to 89%, you know, that means 11 in Knox County it's 89%. That means if you see 100 people in a day, 11 of them might have some communicable disease. So you take your kid to the hockey game or a Red Sox game or to Rennie's, you know, if you see 100 people in a week, you're gonna.
And I'd just like to say, for one local example, so our local elementary school is Camden Rockport Elementary School. The nurse there just had a baby. She's on maternity leave. And the rate for CRESS is 86.8%. So she is going to be coming off of maternity leave with a newborn at home, in a school that has no herd immunity for her, with a baby that is too young to be vaccinated for pertussis, in a state that has pertussis rates that are 8 times the national average? The worst in the country are pertussis rates. So how would you feel if you were that new mom, you know, going back into a school as a nurse where, you know, only 86% of the kids are vaccinated? I would be really worried.
Well, I feel like, for one thing, this bill only addressed going to public school, colleges, daycare. For some reason, online charter schools. You can't do an online charter school if you use the exemption, which would have gone away. But some brilliant thought goes into some of these things. So, yeah.
There's a lot of thought that goes
I would love to hear the argument for why an online charter school that you don't attend, you would be excluded if you're not vaccinated. But we'll work on that one later. So the adult compliance rate with the vaccination schedule is only 20%. I did a room full of 50 people the other day. I said, how many of you follow the recommended schedule so that you keep your herd immunity? 1 out of 50. 20% is the usual compliance on that. So by throwing these kids out of school, they'll still be in your community. They'll be perceived as dirty or something less. You're going to create this minority. Other kids won't understand because you're talking about young kids who are supposed to have 72 different injections by the time they're 5, I believe it is, compared to 5 back in 1963. 72. I might have that one. I'll get that out.
There are 4 required vaccines for kids
So
entering
that
kindergarten.
nurse
4.
might think that she's surrounded by people, only 20% of whom follow the vaccine schedule for adults, and her kids and her will be around these adults in the stores. They'll be playing with the kids outside of school. All you've done is thrown them out of school with this bill. This isn't a good bill.
Of course, if they got vaccinated.
They could stay in school.
Well, there's a couple of things I think are important to address, in that there's certain illnesses that are unique to kids that adults don't get. For example, meningitis. I mean, adults get it, but there's certain ones that kids under age 2 are particularly susceptible to. Measles, mumps, rubella. Once you get vaccinated, when you're age 1 and 4, ideally, you don't need it again. So, and I don't think that's part of the adult vaccination schedule. Chickenpox, again, you're vaccinated when you're age 1 and 4, so that's not going to be part of the schedule for adults. And measles is incredibly contagious. If there was a person in here with measles, we're all going to get it, or everyone who isn't vaccinated is going to get it. About 90+% hit rate. Yeah, you're kind of shaking your head, but that's true. And the rate of death in Europe right now from measles is about 1 in 6,500, maybe 1 in 8,000. Where I get that data from is the European Union publishes the numbers of kids who get measles, mumps, rubella, and in the cases, the kids who got it, about 1 in 8,000 die. So where flu, I don't know what the rates are for flu, but I know it's much higher. So we're talking about measles, which is one of the things which is extremely, extremely bad. I mean, it's the second lead, well, until recently, I think it was the second leading cause of death for kids. Like 400,000 kids a year would die of measles. So, yeah, I mean, so it's, and again, the kids are covered by the adults because presumably you would either been vaccinated, or if you're old enough, you would have gotten measles. So,
How many vaccines do they need before the age of 5?
so the, yeah, so it's Haemophilus influenza B, Streptococcus pneumonia, diphtheria, tetanus, pertussis, hepatitis B, hepatitis A, polio, measles, mumps, rubella, chickenpox.
So that's 8.
Yeah.
I only have one copy.
Yeah, and to some extent,
How many did you say? I'm sorry.
so it depends.
7?
I'm not sure.
Oh, I see. So you're including all the influenza ones in that number up to age 18.
Influenza is not required.
Yeah, so
Right.
there's certain ones that are required by the school system.
Yeah.
There are other ones that are recommended by the pediatrician but not required by the school system.
And
And
then-
then there's flu vaccine, which as far as I'm aware is not required by the school system.
And then I think the
So
other
there's a
thing.
wide variation in the numbers you see.
Yes.
So what you described was 8, and those 8 are the ones that are required.
I guess I don't know what legally is required. So, but I think the other thing that's important to know, because people are like, oh my gosh, there's so many vaccines and kids are getting exposed to so many things. So there's an interesting thought experiment that was done, it was in pediatrics a bunch of years ago. Is it going to get used up by being vaccinated? My presumption from, I guess you're saying, oh my gosh, there's 72 different things. I guess I'm not sure what the issue is there, but what people will say, well, I'm afraid that if I give my children these vaccines, it's going to weaken their immune system while they're working on that, and they might be more susceptible to other illness. And so it turns out, if you get the 4 vaccines that we recommend at 2, 4, and 6 months, use about 0.1% of the immune system. So the way I explain it to folks is if you had $10 in pennies, you had 1,000 pennies sitting right here, and Gretchen asked me for one, I'd slide her a penny. And that's about how much of the immune system gets used up by the vaccines. So, and some of these vaccines, like Streptococcus pneumonia is one that is again, kids are, because they're, especially under 2, their immune system is very different from adults. Well, not very different, but different in that they don't take care of these encapsulated bacteria. So the Haemophilus influenza B bacteria, the Streptococcus pneumonia bacteria, the reason why they're targeted is because they're this bland sugar coat that they have on their shell, the body, especially under age 2, can't make a good immune response to. And so that's why they're included. So
I'd also just like to clarify that for the required vaccinations, there are only 4 that are required for children entering kindergarten. If you're going into a daycare or a preschool, then there are the earlier vaccinations for babies and toddlers that you would get before age 4. But if you are starting school in kindergarten, then there's only 4. So that's DTaP, MMR, polio, varicella, and meningitis starting in 7th grade. And there are boosters, but you've already had it. So if you're going to have a reaction to the DTaP or the MMR, then you would have that on your first vaccination, and then that would be reported as an adverse reaction, and then that would be for your doctor to decide if you should get it again. If it was just like a mild allergic reaction, they generally, that's something that happens. But it's not encephalopathy. Thank you. Right?
I am not a doctor, and I don't even play one on TV. But I want to caution you about language saying that we want to kick kids out of school. I've heard this from a lot of opponents. Oh, they don't want our kids in schools. This isn't true. No. Don't use that language. No one wants to kick kids out of school in this state. We would like to keep deadly diseases out of our schools and away from our children. That's what we're trying to do. So please don't say that we're kicking kids out of school or that we don't want them. That's just not true.
Well, I know that what everyone wants is to protect their children, and the people who feel strongly that there needs to be an exemption, however it's determined that they get one, are either going to get one or they're not going to send their kids to school. So it's going to have the effect of sending a bunch of kids out of school.
Them withdrawing their kids.
That is their choice. And we have anecdotal evidence in our community right here in the Midcoast of schools who said, oh no, I don't want my child vaccinated, but 90% of them with a chickenpox outbreak in the last couple of years, when they were faced with a 21-day suspension, they got their kids vaccinated right away. But the point is, we don't want to kick kids out of school, so please don't make that argument. That's not part of the discussion, and it shouldn't be.
And that bill was all about not having kids come to school if they didn't have these, and that's why it was heard in front of the Education Committee.
So it's not about kicking them out.
Okay.
It's about keeping our children.
Thanks, Chris.
So I'd like to address a couple things. One, a while back, you did mention the pertussis vaccine not being very effective, and I think it's important to note that there used to be a much more effective whole cell vaccine for that, the DTP vaccine, and that was taken away because of complaints and twisting of facts by anti-vaccine groups, particularly Barbara Lowe-Fisher of the NVIC, National Vaccine Information Center, which is not as innocuous as it sounds. So that's just one thing to mention, is that we had a lot more coverage, but there was some fear-mongering about some febrile seizures back in the 80s, and they made that change, and now we have a less effective vaccine. So it's important to note how these things happen. But the thing is, people had concerns, and the powers that be changed it. So it's not the drug companies here, pulling the strings. But what my main thing is here that I haven't heard anyone else address is the way we talk about autistic people. So I have ADHD, which is very related to autism. And I have a son who I believe has ADHD. It's highly heritable. And so I relate very strongly to autistic people. And the way we neurodivergent people are talked about, a plague to be avoided, my life has no less meaning than any of these neurotypical kids who are running around spreading where their parents want them to be able to spread diseases or whatever, or they just don't want to look at the science. But to talk about autism and ADHD and all of these things as something to avoid and treat it just in this very, I don't know, it's a hurtful way. It's really just not accurate to how these things work. We live full lives. I'm glad my parents got me vaccinated, so yeah, I'm quirky, I'm impulsive. This happens, but I didn't die of measles. I get to live, I didn't have to have my life risked for some misguided cause because people believe that you can remove the autism and the ADHD from a person. It's part of who neurodivergent people are. That's not going to go away. Not vaccinating your kid isn't going to make them acceptable or societally acceptable. It's just not how these things work, and we shouldn't be treated like we're a plague when we're trying to avoid actual plagues. So I just think it's important to mention that.
I don't know if you're meaning some other source. I didn't say that it was kids with autism who were going to be kept from the schools by this bill. It was unvaccinated children.
Right, but when we talk about autism as something to avoid, which by the way,
we don't want to avoid autism?
It's, you can't avoid it. People are autistic or they're not. It's just, and it's not worth treating them like they're lesser or like they're lost.
I would also say though that kind of language about linking vaccination with autism and talking about it in the way that you're referring ignores all of the science about what does cause autism. And the science says that it's largely genetic and that it also has to do with the age of the parents and prematurity of birth. So, look at those things too, and you'll see that there are causations that have been studied, but vaccines aren't one of them.
And even most anti-vaccine advocates, shall we say, have moved on from the autism thing and are sick of hearing about that. And they're like, I don't want to hear about Wakefield. Yeah, we know about that. And then they move the goalposts. But if people who are still holding on to that, I mean, there's just not a lot we can do, of course, because as you said, you're talking about beliefs here. So, yeah, we can't fight that. But even anti-vaccine people are like, yeah, no, this is over. Let's talk about something else. So that's kind of concerning to.
And none of the main autism groups support the vaccine theory. None of them.
Does anybody else have
10 more minutes.
I just want to say that I was encouraged that you said in the beginning of this meeting that you are thinking about supporting the bill as it is amended.
I'm still contemplating everything. We're talking to people on both sides.
Is there any missing piece that you feel like you would like from us? I mean,
no, I'm glad we met.
I'm very glad that we've been able. I've learned a lot because I'm not in the medical community, but I've been hearing a lot from doctors and nurses and people in epidemiology and research, and it's been very enlightening. And I understand that you have very strong views about this, and you've done some of your own research. I would hope that you would be open-minded in receiving some of the contradicting information that we're giving you that might contradict some of your current views, because you're asking us to be open-minded and read your studies, but I would hope that you would offer the same and hear some of this testimony. I mean, a lot of us didn't go to the testimony. Maybe we didn't think it was necessary until we heard your testimony and thought, oh my gosh, we should have been there. And maybe you're not getting enough emails and letters from us, but there's a large segment of the Knox County district that you represent that really strongly feels that we should have vaccinations in schools and less exemptions, certainly not the philosophical and religious exemptions that are currently allowed. So that's what the purpose of this meeting was to let you hear our views. And I thank you very much for taking the time and
Thank you. I'm always glad to listen. And if it, like I said, when we get an issue that's completely imbalanced, even if it's against what I believe in, I have to represent the greater voice because I am a representative of the people. That's not the case in this issue. You're very passionate. So are the folks on the other side, and they believe that the things that they've learned support their position, as do you. And I know that's so frustrating for you, and it's so frustrating for them because I've had the same meetings with them and seen the same passion. But I always want to meet with you and hear you, and I really appreciate it. And I'll look at the nurses' information in case there's something new. I really will. Other than a little bit of deeper into the weeds of the science by the doctor down there, I've heard pretty much all of this before, but I do appreciate hearing it and seeing who you are that are representing this viewpoint. So thank you.
So I'll just introduce myself at the end of this. Gretchen Kuhn, school nurse at Camden Rockford Middle School, mother of 2 healthy, vaccinated children. And I would strongly, I think you've heard a lot of really good scientific information from Dr. Stevenson just now, and I really feel like that list in front of you is completely misleading. It's completely misleading on this particular topic with kids and vaccines and going to school. Okay, so that's not correct.
Go look at that.
Yes, thank you. And then the last thing I wanted to say was just about your last comment, and that is that there are a lot of people passionate about it. And that's why this discussion is really healthy, but at a certain point you gotta look at how many people are on either side of this issue. And I would venture to say that there are more people and there is more science behind healthy vaccination of children going to school. And that's the message I'm gonna leave you with.
Okay. And I'll tell you, there were 1,660 pieces of testimony about that bill.
But it went into
2/3 against. It did. That was only 360 people. 1,600 and approximately 60, you can check it on the website, because people submit by email or have someone bring their testimony, and it's still held up at 60% against that bill. Now that it's been amended, you can never know how that might have changed some of the testimony. You have to put your testimony in to the bill as it's presented, because once the committee has it, they can accept an amendment, they can reject it, they can change it. It's completely open once the committee has it. But what was reported out was with the broadened medical exemption that can be done by doctors, nurse practitioners, PAs, with the extension. That's the bill. But I definitely am glad to hear your viewpoints, and thank you for pushing. Yeah.
Are you saying doctors, is it medical doctors, or is it anyone who has a doctorate?
No, it would be an MD,
Okay.
an NP, and a PA.
Okay, all right.
But they can practice now patient-centered. Their exemption can be patient-centered instead of the one that, since you object to the drug company-driven schedule, fill in the blank.
Where did you say the schedule comes from?
I always say drug company driven because there's so much money for studies at the CDC, and I believe they're affected by the drug companies. So when one of their heads goes right on to be one of the drug company management, I feel like it's driven by them. But if you reject that, we won't get into that. What I'm saying is it removes it from that schedule and now allows patient-centered care within their scope of practice. It does not have to look at anybody else's schedule.
I don't want to defend the drug companies. I mean, they're problematic.
I hope
but the CDC, now we're questioning National Institute of Health, the CDC, the American Medical Association. I mean, at some point, not that I disagree, the drug companies are problematic, but this has nothing to do with the drug companies. Really,
they're going to make $60 billion this coming year. They're trying to develop 250 new vaccines.
Vaccines are not
Yeah, they're
Well,
not
they are
running
trying to
awareness.
develop vaccines, I agree with that. But the vaccines are not we need to separate the issue of vaccination, right? I mean, vaccination is not a theory, it's a fact. You know, it's like saying, well, the analogy might be, well, Darwinism is a theory and creationism is a theory. And both are theories, and both are somehow equal. Like the anti-vaccination people, their theory is equal to those who argue for vaccination. Vaccinations are medical science. The other, I don't know what that is.
So thank you very much for managing to get because of the extra email, it made me put something in this hour that opened up suddenly. So thank you for getting together, and please buy something from Steve, and I'll take a look at what you presented and consider it.
It's really
Thanks a
insulting
lot.
that you say you imply that they weren't practicing patient-centered care before. I send
They
my
weren't
son
allowed to, the medical
I send my
exemption
son
did
to
not allow
Dr.
it.
Stevenson. He's always working in my son's best interest. He's always working. They're not working in the parents' desires, but that's not the same as patient interest. Medical exemptions were always there for legitimate concerns. It's just not like boutique, hipster kind of maladies that people invent for their exemptions. Doctors and nurses were always practicing for their patients. It's dishonest to imply otherwise, frankly.
Yeah.